Hey everybody, we're here from the Syracuse Planned Parenthood talking to you all today about STIs and HIV. Before we get started, here's our team at Planned Parenthood. I'm Hillary.
I'm Mallory.
And I'm Giovanni. Now, let's talk about STIs or sexually transmitted infections, how common they are, how they're transmitted, how to prevent them, how to know if you have one, and finally, what to do if it turns out you do.
Okay, before we have a discussion, we're going to watch a short video and we'll be right back to chat about it.
STDs are infections that can be passed during vaginal, anal, or oral sex. Some STDs are carried in semen, pre-cum, vaginal fluids, and blood. Others can be passed just from genital skin-to-skin contact. STDs are super common, and they usually don't show any symptoms, so lots of people don't even know they have one. The only way to be totally sure you won't get an STD is to never have any kind of sexual contact with another person. But the reality is most of us do have sex at some point in our lives. So the best way to help prevent STDs is to have safer sex. Safer sex means using condoms, female condoms, and dental dams every single time you have vaginal, anal, and oral sex. These barriers help block body fluids and some skin-to-skin contact that can spread STDs. Using barriers can even make sex better. When you're protected, you can relax and focus on each other instead of worrying about STDs. There are lots of different styles of condoms, and many are designed to increase pleasure. Adding water-based or silicone lubricant makes condoms feel great and helps stop them from breaking. You can get condoms and lube at most drug and convenience stores. If you have sex, get tested for STDs regularly, even if you always use condoms and feel totally fine. Testing is the only way to know for sure if you have an STD. It's usually quick, painless, and sometimes even free. STDs might seem scary, but most can be easily cured with medicine and don't cause any serious problems if treated early. And there are also treatments for STDs that can't be cured, to help with symptoms and lower the chance of giving the infection to someone else. Having an STD is nothing to feel ashamed of, and it doesn't mean you're a bad person. The reality is STDs are super common, and most people get one at some point. People with STDs can be in relationships, have sex, and live totally normal lives. Want to learn more about STDs? Check out PlannedParenthood.org.
All right, so like the video mentions, STIs are infections that are spread through anal, oral, and vaginal sex. The video also says that some STIs can be passed from skin-to-skin contact as well as through fluids. Because of the many ways that STIs can be passed, they're super common. Lots of people have them and don't even know because they don't have any symptoms at all. Since most STIs don't have symptoms, the only way to know if you have one is to get tested regularly.
To give you an idea of how common they are, 1 in 4 people will have one by the time they're 18 years old, and 1 in 2 will get an STI by their 25th birthday. So knowing that, it's not surprising that 20 million people in the United States get an STI each year, and half of those people are between 15 and 24 years old.
Here's a list of the most common types of STIs and which parts of the body they can affect. In fact, we are sharing this list with you all because we'd like to acknowledge that STIs are passed different ways and can infect multiple parts of our body at once. We aren't going to break down every single STI on this list, but we do want you to see that each of these can affect different parts of your body. It's really important to talk to your doctor about what kind of sex you're having with your partner so they know which part of your body to test.
So speaking of testing, there are a lot of ways that we can be tested for STIs that are usually quick, easy, and painless. Sometimes a doctor will test someone's blood or urine for STIs, and other times a doctor will use a swab to sample or perform a visual exam. So where can we go for these types of tests? One place would be Planned Parenthood or Family Planning Services. You can also ask your pediatrician or your primary care doctor for tests, see if they offer them. We definitely do not need an adult, a parent, a guardian, anybody to come with you for you to receive these services. And we will never tell anyone why you are here. That is your personal business, and we remain confidential. If you do go for testing, we are commonly asked, will they test me for everything? And the answer is no. 9 times out of 10, they're only going to test you for what they have available there in their office. They won't be testing you for every single thing that you saw on the previous slide, so be specific with your doctor. Ask them what you were tested for and see if they recommend everything. So how often should I get tested is another great question. This is really up to each person, but the recommendation would be every 3 months or with every new partner.
What happens if you get tested and it turns out that you have an STI? The good news is all STIs are treatable. The best thing you can do is follow your doctor's instructions. Treatment depends on the type of STI you have. There are 2 categories of STIs, bacterial and viral. Bacterial STIs are treated and cured with prescribed antibiotic medication, so long as you take all the medicine the way your doctor tells you to, even if you're feeling better, then you'll be cured. Viral infections can't be cured, but they are treated and managed with prescribed antiviral medications, meaning with help from a trusted doctor, people can live a long, healthy, happy, active, loving life with a viral STI like herpes or HIV. Life changes, but it's not over.
So what do you do once you get treated for an STI? It's definitely important to share with your test results with anyone you've had sex with or thinking about having sex with. If you're afraid to tell a past partner that you're being treated for an STI, we get it. There's a program for that called Partner Services, and they can anonymously contact any past partners without giving them your information. As far as new partners, lots of people find their sexual history to talk about their sexual history embarrassing, but it's a way to build trust and respect in a relationship, whether it's casual or serious. We recommend being clear and direct and saying something like, "Have you been tested for an STI recently?" instead of, "Hey, are you clean?" Communication is the way we stay safe.
Some other ways that we can keep ourselves and our partners safe would be by educating ourselves with medically accurate information. Talking to your doctor and your partners is a great idea. Get tested and treated before having sex. And also being clear about when you and your partner are ready to have sex. Using barriers like condoms, internal condoms, dental dams, and adding water-based lubricant to prevent tearing is another great way to prevent STIs.
So how are STIs and HIV connected? HIV is an STI. And if you have one STI, you are more likely to get another. That means if you're exposed to HIV while you have another infection, it's more likely that you'll become HIV positive from exposure. Similarly, it's much more likely that you'll pass HIV to a partner.
So here's a video that explains HIV.
If you have HIV, there's a good chance you want to know what's going on inside your body. You may have searched online, you may have asked someone, you may have even watched a video or two. Now, if you're confused, stay right here, because I'm breaking it down for you. First, know this. HIV is a virus. The letters stand for human immunodeficiency virus. Now, I know what you're thinking. Immuno what? But this is a good place to start, because we need to talk about your immune system. Your immune system protects you from disease and helps keep you healthy. It does this with the help of some really important cells called CD4 cells. You may have heard them called T cells. Inside your body are lots of CD4 cells. They are the fighter cells, the defenders against germs. They help keep you from getting sick. But get this, when HIV enters the body, it goes right after these defender cells. It finds a CD4 cell, invades it, and just takes over. If that doesn't sound good, well, it isn't. The CD4 cell is not helping you anymore. It's working for HIV. The infected cell becomes like a factory, making new HIV particles, and these virus particles go on to invade other CD4 cells. That's what HIV does. It multiplies itself inside your body. Now, while this is happening, you may look completely fine. You may feel fine, but the virus is still inside, working away, causing harm to the body. That's the trick HIV plays. Before you even know it, the number of CD4 cells in your body is going down, and the number of virus particles is going up. That's why HIV is an immunodeficiency virus. Your immune system has less fighting power to keep you from getting sick. This can lead to serious infections, to cancer, and of course, to AIDS. The thing is, this doesn't have to happen. You can take care of your health. Now, there is no cure for HIV, but there are many treatments available now to help stop the virus. Remember how I told you HIV works to multiply itself inside the body? Well, HIV treatment stops this from happening. The virus factories get shut down. The CD4 cells go back to protecting. The number of CD4 cells could even go up. That's why it's important to talk to your healthcare provider and start treatment before you feel sick. Waiting just gives HIV more time to harm your body. So don't let HIV build a virus-making factory out of your cells. No way. Take care of yourself and stop the virus.
So, simply put, HIV means human immunodeficiency virus. Once it enters the body, it damages our immune system, and without any treatment, it can lead to AIDS. AIDS is different from HIV. It stands for Acquired Immune Deficiency Syndrome, and it happens when HIV damages the immune system so severely that it can no longer fight off any infections. For example, a person living with AIDS may struggle to bounce back from even a cold.
So there are 5 fluids that transmit HIV. They are breast milk, blood, vaginal fluids, semen, and anal fluids. There are 3 ways that HIV can be passed. This is through unprotected sex of any kind, mother to child, or through sharing needles with someone living with HIV.
The most common HIV tests are rapid, meaning you'll know your status between 1 and 20 minutes after a provider takes a small sample of blood or oral fluid. Although tests are really quick, it's important to keep in mind that it can take some time before these tests can accurately detect HIV. No HIV test can detect HIV immediately after infection, so we recommend people wait 1 to 3 months before going for a test after they think they were exposed. So what happens if a person ends up having a reactive test or they're positive? Treatment is so important. It's life-saving. Talk to your doctor. They'll prescribe you an antiviral medication. Nowadays, folks just have to take 1 or 2 pills and they'll live a long and healthy life. Medication helps us to reach an undetectable status where HIV doesn't appear on a test anymore. That's because there's so little of HIV virus in your body. Once someone is undetectable, they don't have to worry about sexually passing it to a partner. This is called undetectable equals untransmittable. To stay undetectable, we have to take our medication as prescribed. And since we all tend to forget sometimes, a good way to stay on point is to talk to your partners or loved ones about your status and the medications you're taking. Think about folks like Magic Johnson, who has been living with HIV since the early 90s, has not had it develop into AIDS, and has not passed it to his wife or his children. If you're negative, but you have concerns about HIV, there are some additional ways to prevent it. In addition to using condoms and lubricant and getting tested, you can ask your doctor about the medication called PrEP. PrEP is a pill you take once a day, and it helps to prevent HIV.
If you're interested in free testing, condoms, and lubes, or PrEP, here are some ways to reach us. You can book an appointment online or over the phone. For some of our appointments, you don't even need to come into our clinic. We can just video chat, just like we're doing now. You can also DM us any questions and comments on our IG at sarcasticSexEd or through our anonymous chatbot, Rue. Thank you so much for tuning in. Feel free to contact us anytime.
Thank you.
Thanks.